Hello. Good morning, everyone. Caitlin and Brian, thank you so much for joining and taking some time out of your day to come and talk with us. We really appreciate it.
Of course, I'm excited to just kind of like participate and check it out. I know, yeah.
Yeah, so I think our plan for today is we'll just do some quick updates for like 10 minutes or so on
Mhm.
our end, and then we're gonna just go into a very informal discussion. We have a few bundle of guests here, and we'll just have you all kind of talk about certain topics as they arise. I think you got our agenda right, and those are some of the topics that we talk.
Okay, sounds great.
Right? Awesome. Welcome everyone.
Good morning,
Starting,
everybody.
we're gonna
Good
get started in just
morning.
a few minutes.
Good morning.
Good morning.
Good morning.
If you all wanted, I think we're gonna do introductions pretty quick today. We're gonna just put our name and where we're from in the chat if you wanted to start doing that. And please include your email if you feel you want to share it with the group. Welcome, everyone. Thank you for joining. If you're just hopping in, if you could put your name, where you're from, and your email in the chat, it would be much appreciated. Thank you. We're going to give it just one more minute for some more people to filter in. It's an early start here on Thursday morning. The week's almost over. Almost. Was anybody able to see the Northern Lights last night? I heard that was maybe a possibility. I didn't see it though. It's a little too cloudy, I think.
I know the
I
night
saw some of it
before
from where I
last
live.
there was.
Oh, Victor, you saw it?
I saw it from where I live. I saw a little bit of it.
Oh, cool. I think a little while ago they said you could see it too, and I saw it through my camera, but you couldn't see it to the naked eye. But
Yeah, I have a telescope. I live in actually in Atlantic County, so I have a pretty clear view at that point. But yeah, I saw some of it.
all right, welcome everyone. Just one more time, if you could put your name and where you're from and your email in the chat, it'd be much appreciated. We're going to get started because we have quite a packed schedule today and lots of great discussion. So we want to make sure we get to all of that. So welcome to the Safe Communities Coalition regional meeting. This is for this month, and then we're going to have our celebration next month. My name is Nick Marcantuno. I am the coordinator of the Safe Communities Coalition. Jerry and Amanda, if you want to introduce yourselves really quick.
Hi, Jerry Colavecchio from Prevention Resources, and I'm the director of the Safe Communities Coalition of Hunterdon and Somerset counties.
I'm Amanda, and I run the opioid work group.
Awesome. So I would love to do introductions and vocal introductions for everyone here, but we have quite a lot of people and not a lot of time. So I want to just keep that in the chat for right now, but we appreciate all of you being here today. We hope you take a little something back to your community and that can make some change. So like I said, we do have our celebration next month. Amanda already sent a flyer out about that, but we'll talk about that a little more at the end to save time. First, we're going to do some work group updates, and then we're going to immediately go into our big discussion. So I will start for marijuana. So we actually have some huge marijuana updates today. As the government reopened last night, Delta 8 and all those unregulated THC products have officially been banned at the federal level, which is huge. It was a part of the huge package that they signed last night. So that means all those THC products, no matter if they're called THCO, THCA, Delta 8, Delta 10, all these different products, they are all banned and illegal to sell throughout the entire country. New Jersey still has something ongoing where they're trying to move some of these products to the regulated dispensaries. I'm not sure where that is going to go after this. I think it's still probably going to happen in some form, but it's going to take about a year to implement this. They have 365 days in order to implement the ruling, but we're going to find out more about that in the coming days and what that means. So we could still see these on shelves for the next year, but the great news is they're all going to start being phased out over the next few months to year, which is huge news for us because we've done a lot of advocacy. I know you all have done a lot of work on that, and we really appreciate the efforts, all the messages to congressmen and all the education we've given to the community has all been a part of that. So thank you. And I want to also give a quick shout out to Franklin Township in Somerset. Donna Lisi has been our champion over there with the town council, and it is to our knowledge that consumption rooms for marijuana have now been banned in Franklin Township, which is huge. That'll have a huge effect on safe consumption, perception of harm, hopefully prevent driving accidents, and driving under the influence. So huge thank you to Donna on that, and huge thank you to Franklin Township for really taking that step to ban those consumption rooms. All right, I'm going to move to the opioid work group. And then after we go through all our updates, if anybody has any comments or questions, please feel free to raise your hand in the chat.
Just a quick update from opioids. On DEA Take Back Day in Hunterdon, we collected 375 pounds of medication that day. And in Somerset, we collected 205 pounds. So that all gets turned over to the FDA and destroyed. And then on Save a Life Day, in case you missed it, in Hunterdon, we distributed 820 kits of naloxone, and Somerset 977 kits of naloxone. So that's almost 3,600 doses across both counties. So super win. Thanks.
I just want to give a special shout out to Wendy and Amanda for coordinating Save a Life Day in Hunterdon County, and Stephanie Billets in Somerset County for coordinating, and all the people that and businesses, and a lot of people are on here that participated, agencies. So I just wanted to give you a big shout out and thank you, because for me, it's like one of the most exciting days of the year, because it just really sees the community come together in action for the same cause, to make sure that everybody has access to naloxone and are educated on why everyone should carry it. So big shout out to everyone on here. Thank you so much.
Yeah, thank you again. And Jerry, if you want to give some quick alcohol updates.
Sure. So we're working with the Drug-Free Task Force from Hunterdon County, and we've been doing some events at Raritan Valley Community College. We just did one for Halloween. The events are sober events, and the main purpose is to really show people that you can have fun without having alcohol. And Halloween this year was the first time we participated in, and we will be doing Zero Proof Pub Night. I think it's in like after 2026. I don't like 2006, 2026. So it's really just exciting to see the college students having a really good time and not needing alcohol to be in the mix. So those are some of the things we're working on. We're also working on alcohol along with marijuana, Lock It Up campaign, and we'll continue with that as well, and some other things which I'll follow up with if we have some time at the end.
Awesome. Thank you, Jeremy.
Yeah, Amy's not here today, so I'm just going to give a quick shout out to her about the Hope Club. She's been doing a lot of different lunch and learn activities, facing fentanyl, marijuana. Let's talk about weed, which is just a conversation with the students to kind of see where they're feeling, what they know, what they don't know, who's using, who's not using, etc. I know, pills to heroin throwback. Thanks, Caitlin. I can't remember what I did yesterday, but I can remember what I did 10 years ago. So thanks for that. So those are just some of the things that the Hope Club is doing. They do cakes and condoms. And so they're really out there with the students. They participated in Save a Life Day as well. So really good stuff going on there with our college students in the county, which covers both Hunterdon and Somerset County. So with that being said, I think we'd like to move on. We have a really great discussion and a lot of great special guests here today, which I'm really excited about. So just wanted to get started with that, and I wanted to welcome some of our special guests. We have Sergeant Martinez from the Counter Drug Force. He's actually a part of our coalition, so he's not special guest, but he's extra special today. Also, we have Somerset Prosecutor's Office Assistant Prosecutor Caitlin Davis. So thank you so much for taking the time to be here today. We really appreciate that. I also saw that Catherine from the Prosecutor's Office is also on today. We also have Joanna Ondurko from the DEA. We weren't sure where we were going with Joanna today, but I'm happy to see that she's here. She had to wait for the shutdown, to reopen, for the government to open up. And we also have Detective Sergeant Brian Hanley from the Hunterdon County Prosecutor's Office, Narcotics Division. Last but not least, we also have Alice Murray and Cameron Quimby from the probation, which covers Hunterdon and Somerset and Warren County. So welcome, and I appreciate you all being here today. The reason why I kind of like we wanted to put together some of the folks that are here today was because they have great information of what drug trends are having, what they're seeing at their high risk adolescent population, which will kind of give us an idea of drug trends for our high risk youth. And all the information that we'll gather here today, it will really help us as a coalition and a community to plan for our 2026, because we really like to keep the our initiatives data-based and data-driven. So we brought the experts in today. So thank you all for coming, and we really appreciate your time. We know how precious that is, especially for the prosecutor's office. So with that being said, I just wanted to say, I know Sergeant Martinez had brought it up. He sent us a flyer a couple of weeks ago on 7-OH, which is a derivative of Kratom. So thank you for that. And that kind of is like what prompted this, that we really should be talking about like what drug trends. So we want this to be as interactive as possible. And we want to hear from everyone here, even like, especially like the schools as well, like what you're seeing, what you're hearing. So we're going to kind of keep this informal, more conversational. So please, if you have questions, you have things to add, just raise your hand, and we will certainly reach out to you. So I think one of the things that I wanted to really see is from the prosecutor's office in Hunterdon, Somerset, probation. What are you seeing? What are your cases like? And obviously we know we don't need to know names or anything like that, but what are the typical cases that you're seeing that relate to substance use, mental health, violence? So Caitlin, I see you nodding your head, so I'm going to start with you.
All right, sounds great. So good morning, everyone. I'm an assistant prosecutor, and I'm often in the juvenile courts. And I did go around and talk to every one of our juvenile prosecutors just to see what their caseloads are like too. And it really is rare in Somerset County that we'll have juveniles coming in to court on charges that are only drug related. So usually when we're having cases that tie to another substance, it's with like property damage or criminal mischief. We'll have some cases that are tied to alcohol use. And then another set of cases that we'll have some crossover often will be our weapons related offenses. For some reason, a lot of the weapons related offenses, the youth will also report a history of using marijuana. So it won't even be tied always to the actual offense, but once they are in the court system, when we're trying to craft a resolution, it will come up as something else that maybe we should consider as part of our resolution, because our goal in the juvenile court is really rehabilitation. So we'll look at things like outside of maybe the specific charges for why they're in. And sometimes marijuana use is even coming up in some of our sex offenses, which may also seem like unrelated, but it just, the way the crossover, I guess my point is that the crossover is not always like blatant on its face, but once we start talking to the youth, it's kind of across the board in different offenses. But without a doubt, we don't see a lot of substances beyond alcohol and marijuana, at least in Somerset County. And every juvenile AP I spoke to was like on the same page that maybe they'd have one or two, but it's just very rare for our current caseload.
That's great. Thank you. I appreciate that. And I'm glad that the prosecutor's office is looking at the whole the whole student or adolescent, and seeing what other services that they may need. So that's really great to hear. Sometimes I know even with our LEAP program in Hunterdon County, it's not always a first offense, but it's combined a lot. So thank you for that. I appreciate it. Brian, I know you are in the narcotics division. Are you seeing anything trending in Hunterdon County? Any substances that you haven't seen before or that you have heard of, but now it's more often?
Yeah, thank you, Jerry, and thank you, Nick, and everybody for having me today. I'll get on my high box for a little bit and just kind of go over what we mean by like drug trends. Um, Especially in Hunterdon County, we're kind of like a microcosm of the state. When the state starts seeing like certain drugs that take off, Hunterdon County's usually, a couple months behind, but they do follow the same trends as the state. And when we talk about trends, we talk about profitability for the drug dealers. And when it comes to the sale of drugs, the trends are consistent with what's available and what's cheap. It's just like any other kind of business in a sense where if methamphetamine is the cheapest drug out there, there's going to be a spike in the methamphetamine use. Same with cocaine, same with heroin or fentanyl for that matter. It all comes down to the accessibility and the availability and the price. So in Hunterdon County, the last year and a half, methamphetamine has been the cheapest product out there. The price has drastically dropped over the last 5 years. And because of that, the usage in Hunterdon County has gone through the roof. So just in recent cases, we've seen a lot of burglaries, a lot of home invasions that were stemming from methamphetamine use, either to get money to continue the use or because the individuals were addicted and kind of coerced into kind of going with a group of individuals that were of the same mindset per se. The good thing, on the other hand, is that heroin use has dropped. So just for an example, in 2026, our overdose statistics, we're at 27 overdoses with 7 fatalities. Last year at this time, we had 62 overdoses with 8 fatalities. The fatal number is staying the same, which is always concerning, but the overdose numbers are dropping drastically, which is a good thing. But when you read between the lines, other individuals are using different substances, which is kind of correlating with the droppage of the overdoses, if that makes sense. And then the same thing, just to parlay off of what Somerset was saying with the juveniles, it comes down to social media. It's what kids are seeing nowadays, what's being glamorized, what's being pushed through TikTok and Snapchat, and what's for lack of a better term, the cool thing that kids are doing. And I'm glad that the state is slowly addressing the Delta 8, because the fact that you can go into a gas station and buy that's unacceptable. So I'm glad that they're at least trying to address that slowly. But for any kind of drug trends, I'd say Hunterdon County is, high on the methamphetamine use and high on the cocaine use. And that's relevant to the cost and the availability of the product. So,
Are you seeing anything with Kratom, 70H? I know it's been around for quite a while.
yeah, again, it's the fact that you can go and get it easily makes it always concerning. We're lucky enough to not have a major issue here in Hunterdon. I haven't seen a ton of cases come my way recently. I mean, every once in a while you do see a few outliers that relate to those kind of things. Same with like MDMA or ecstasy. We do see that every once in a while, but that's more of like a college, younger crowd kind of drug, and we just don't have that atmosphere in Hunterdon County, thankfully. Like there's not a big bar scene, there's not a big college scene here in the county, so we're not seeing those type of drugs. Are they out there? Yeah. The big drug that the state is seeing now, they call it 2C, which is a mixture of cocaine and MDMA. That's a very popular drug right now, especially with the younger crowds. But in Hunterdon, few and far between. For the most part, our biggest issue that we're dealing with right now is the methamphetamine.
Okay, thank you so much, Brian. Appreciate that. Alice, Cameron, and Sergeant Martinez, do you have anything to add to that? I know, Sergeant Martinez, you work with coalitions across the state of New Jersey, and I know that obviously Hunterdon County looks very different than Essex or Camden County. Same thing where Somerset looks different than Hunterdon. So do you have anything to add to the drug trends that you've been seeing, the kratom, meth, cocaine, or what you're hearing from other counties other than Hunterdon or Somerset?
Yeah, so a lot of what was already brought up has been kind of statewide. The biggest alarm that kind of raised a lot of eyebrows recently was the 708 kratom. And that was mostly just because of the accessibility to it. And then now we're seeing an uprise in kratom being mixed with other substances to get a more potent feel. Um, and just recently, one of our colleagues did a focus group, I believe in Monmouth County, and kratom was a huge conversation point, and they're seeing signs of like overdose and withdrawals from the kratom use, and especially in like heavy doses of dependency there, and mostly because it's just such a easier access than the opioid, so it's used as a substitute. And the issue that we're seeing a lot of with the kratom use is that doctors are prescribing it, or at least suggesting it, that it's a safer alternative to an opioid. Um, and it's also over the counter type like suggestions, where if somebody comes in and they're talking about pain that they have, or specific feelings that might be subdued due to the use of kratom or anything like that, it's being recommended more, and it's because of the ease of access and that like almost like that quick fix that they can get through to kratom that they wouldn't be able to do by going to a doctor and getting prescribed an actual opioid. So that as a substitute has been such like on the rise, especially now with the potency of 7OH. And then there's also been cases of uh, youth and binge drinking. As it was mentioned before, meth is kind of on the rise right now, just because it's cheaper, and we're seeing it more in certain areas where it wasn't previously. And K2 is also kind of making a rise because again, it's the cheaper alternative. Since the passing of the marijuana legislature, now things are kind of being a little bit more regulated and things are being enforced and they're going through dispensaries. But again, that cost of the product is going to be taking a toll on a lot of people who are looking to, find marijuana or use cannabis in lounges and things like that. So they're finding that K2 was a very top discussed item, as a synthetic substitute, as well as kratom and meth on the rise and being mixed with one or the other. Um, do I have the capability to share my screen by chance, Nick? All right.
Yeah, you should be able to.
All right. So can everybody see this? Awesome. So this was, if you haven't seen it already, this was the public service announcement we put out in October for the 708 Kratom. Just wanted to highlight, what the product looks like on the shelves and talk about specifically the potency of the 7OH, the chemical compound in it that's being focused on more so now for a more potent, effective drug in a sense. Um, and I'll be able to send this updated version to you guys as well if I haven't already. But part of what we did with this public service announcement is we started to look into the New Jersey law and the legislatures around kratom and what we need to know about that. So, what we have now, we have a paralegal specialist with the Air Force who works with us, and she was able to do a deep dive on kratom and what it looks like on our legislature, and as well as on the federal level, what that looks like. And these are just some of the things that we have in the state of New Jersey as of September. Um, Earliest November that we're in now is our latest update, but um, the biggest things is that it is still an ongoing battle about getting it regulated by the FDA and things like that. We have CJ's Law and there's the New Jersey Kratom Consumer Protection Act. Those things are still a work in progress, but ultimately it's to highlight the importance of regulating the substance and treating it as a opioid substitute and taking it more seriously, than it is than just going to a regular gas station or store that's selling it openly and willingly suggesting it more and more. just understanding what it does to the body, to the mind, and a lot of the side effects that comes with the substance as well. And a big sell for the product is that it can be smoked, it can be brewed in a tea, it can be taken as a vitamin supplement. There's so many different ways that they can use this product that, it's like to each their own, So that being such a big sell, it raises a lot of questions as to whether or not it's good for us in the long run. And getting it regulated is that next step. Now with the government being open again, I'm hoping that, with the discussion of Delta 8, Delta 9, and all those things being lumped into that package of this legislation that's coming out within the year, hopefully the Kratom can kind of start working its way more into that realm as well, so that we can actually start regulating this product. And here's what it looks like on the federal level. So as of April of 2025, 24 states regulate kratom or its component in some manner, but only 6 states, which are Alabama, Arkansas, Indiana, Rhode Island, Vermont, Wisconsin, and then the District of Columbia, um, treat it and consider it as a psychoactive component, and it's a controlled substance. So they strictly banned it on shelves and things like that, and it's not regulated in any of our controlled U.S. territories, but every state has the ability to say yay or nay. It's just a matter of, the votes that come in and things like that, just like New Jersey is doing on our end. And it hasn't been approved by any means, but it is still an ongoing battle. And this graphic and this whole pamphlet that I put together will definitely go out to you guys to share and just to keep on hand for more information and awareness. But that's about all I got. Other than the focus groups coming out right now, it just shows that kratom is being mixed with a lot of things as well as binge drinking, um, and the rise of crystal meth and K2 spice.
Thank you, Sergeant. I appreciate all the information, and it's really great to see that on a state and federal level that they are looking at this seriously and looking into legislative bills and hopefully laws at some point. So thank you for that. I appreciate the date.
And I just want to add really quick too. Just what I've seen. I've been going out and scanning a lot of stores recently, and there has been a lot of 7OH products and Freedom products in stores that sell tobacco and also in liquor stores to pair with the alcohol that they're selling. So in Hunterdon and Somerset County, I've personally seen it. So just keep an eye on it. If you go into a convenience store or a vape shop, just look for that 7OH symbol and just kind of take note of like where it's being placed. Is it at children's eye level? Is it being given out to customers under 21? Um, and that's what we're really concerned about with it.
Thanks, Nick. I'm going to go to Alice and Cameron from Somerset County Probation. And if you guys can give us a little insight of what you're seeing, hearing.
Good morning. I'm Elise Murray. I predominantly have the SO juvenile caseload now. Cameron just was brought onto the juvenile unit, and so she's hitting the ground running. But historically, the things like kratom is not something that I've seen with the youth that we've had on probation. I will say that our caseload is much lower than it had been a few years ago when I started. Although we do kind of have a higher probably proportion of SOs than we used to have. So one of the things that I can say is most of the kids that I've followed for the last several years, they predominantly it's THC. They don't, I mean, in fact, if you ask them if they drink, they're like, no. They really don't like drinking. They don't like how it tastes. They don't like how they feel. There's a couple of them that dabbled in drinking, and they kind of end up getting into a lot of trouble. But most of them, it's really the THC. And in my experience, the kids think it's it's pretty benign. And even asking about it, they're sort of like insulted. I'm like, it's still not, you're on probation, number one. Number two, it's not legal for you. Um, and and then we send them for evaluations, and they generally do treatment, and they keep going back to it. But when you can finally get them off of it and they can really look back, they're like, wow, I really was kind of dependent on it. And oh, I kind of was lazy when I was on it. So they, once you kind of go a couple rounds with them, if they can break from it, they really see the issues. But it takes a lot. It takes a while.
And I apologize for mispronouncing your name, Elise. So thank you for that. Also, they using it? Do we know? Are they smoking it, vaping it, dabbing?
All of it. Yeah, all the ways. Yeah.
Okay. Thank you. Cameron, did you have anything to add?
Not quite. I'm pretty new to juvenile. I can say with my experience with adult, a lot of what the adults were testing positive was for THC or cocaine. But I'm still getting familiar with the kids.
Okay, well, welcome.
Thank you.
Appreciate it that you being here today. Joanna, do you have anything to add as from the DEA's point of view?
Hi there. Can you guys hear me?
Yeah. Yes.
Cool. Not too much. I know that we have a National Guardsman named Sydney who sits in our office here, and Sydney and I are working on collecting all the information we can on Kratom to see what we could recommend to DEA to do in terms of like education, because we don't have a lot of education on it. When I was looking through our publications, we have a drugs of abuse booklet, and it only has one page on Kratom, but it says that DEA has listed Kratom as a drug and chemical of concern, which is interesting. So what I'm going to do in my research is talk to my other community outreach specialists throughout the nation, see what they're seeing, and then make some recommendations to our main office at DEA saying, hey, maybe we need a presentation on this, or, a new kind of fact sheet or stuff like that. Or I could also see if I don't think that they work with the FDA. I don't even know if FDA has like an outreach person. I'd have to do more research, but that's an idea that we could possibly explore too, is kind of looking at it from their perspective, FDA's perspective. So I could tap into the federal connections and see what they're doing on that end. But it's interesting from our perspective. We get like reports, like toxicology reports sometimes from the drugs that DEA seizes, and I'm seeing a lot of Kratom come up in certain cases, which has been really, really interesting. So that's kind of how we got involved in it, just because we're seeing more of it pop up in our labs. So that's it for me, but looking forward to, working with everybody on this, and if we could help in any other way, let me know.
Thank you, Joanna. Appreciate that. Are there any other drugs that you are seeing a lot that you're seizing? Especially in New Jersey?
I don't have those numbers for you, but I can go back and get them. I just don't have those numbers available. But I can definitely go back and get them.
Okay, great. Does anybody have any questions for any of our guests today, or anything that they want to bring up? Are anybody seeing any of these specific drugs popping up in, their agency, if you're doing counseling or treatment, recovery?
I see Caitlin has her hand up.
Hi, so I'm Caitlin Cartoccio. Oh, my video hasn't been on this whole time. I'm Caitlin Cartoccio. I work for the Bernards Township Health Department, and I'm also the Municipal Alliance and Youth Services Coordinator. So I also oversee a group of students called REACH, Ridge Education, Action, and Community Health. A lot of you that are on this call know about them because I talk about them all the time. But every summer we go to a leadership camp and I allow the kids to come up with whatever topic thing that they want to cover during the year. And this year there was a lot of discussion around things like Delta 8 and Kratom and things that are available at, say, gas stations and convenience stores. We have a bunch of those here, both in Bernards Township and in the surrounding towns. So something that the kids brought up that they would like to focus on is educating their fellow youth about the dangers of these products because it's kind of seen as a convenience thing. I can just go here and get it. It's very easy. But they also want to educate parents about them existing at all. I know that sounds like a very basic topic idea, but a lot of parents aren't aware that they exist unless they work in the youth space or drug and alcohol space themselves. So I'm just looking, this is kind of to anybody in the collective. Anyone has any ideas for, I guess myself as the alliance coordinator, because I'm sure this is something that my adults want to focus on, but what can my students focus on in educating the fellow youth around them to not pursue these products, but also educating parents in a way that's not, you need to do this and you're a bad parent if you don't, because they're kids and sometimes they look at it, well, parents don't know anything that's going on. Okay, reel it back a little bit. We gotta be kinder around the situation. So sorry for the long-winded question, but I just want to do my best to educate, the community that's in front of me and allow the kids to have a voice in what they do.
Yeah,
If
I
I
think that's
could,
perfect.
yeah,
If someone, can jump right in. I was just going to say, somebody can jump in.
thank you. No,
Yeah.
something that I preach day in and day out for the last like year has just been resiliency. Um, Having something along the lines of healthier coping skills and coping mechanisms than finding the nearest substance is always a good help. And especially for the youth, if we are giving them the tools to at least identify in a healthier way what it is that they're dealing with, taking a second to kind of reflect on those things and use some of the skills that are taught through resiliency to get past it, I think is a huge help. And it's a great tool to have, even just not just with like drug prevention, but just in general. When I went through the training, it helped me reflect on a lot of things that I didn't notice was a habit of mine. And now I can't go anywhere or do anything without recognizing those things. So if we were to do that at an earlier age, we would see so much more potential for prevention and interdiction and anything like that. So that's something that on our side we can definitely help with as well. As far as resiliency goes, we have myself and our colleague Sergeant Montero, who is also Master Resiliency certified through the Army. That's something that the Army is moving away from, but we do still utilize the training with counter drug, just to kind of again just help the best ways that we can. So if that's something that you're interested in, we'll definitely come out, do a portion of resiliency for the kids, and just kind of push whatever we can. Not just kids, but anybody who wants to come.
Yeah,
Like we're
that's
just gonna have a party in Bernards for everybody. I love this.
yeah, no, that's great. If we could do something and work together as different agencies in the community, that would be awesome if we could put something together, especially to reach the parents. And I love, Caitlin, that you always do your peer-to-peer with your students, and you guys rock out there. So way to go. You're really good. Kids are always out there doing something and being involved. So it's really nice to see. Anybody else have any questions, anything they want to share, anything from a recovery support side that you'd like to add to the conversation? We'd be happy to hear from you.
Jerry, I'll pop in real quick.
Yeah. Thanks, Renata.
Hi, everyone. My name's Renata. I'm the manager of the Safer Together Harm Reduction Center here at Prevention Resources. I can't remember if no, I wouldn't have stated it last meeting. So we do a lot of outreach to in Hunterdon County. We don't really have a fixed site, but I did want to mention that we had a participant, I believe a month ago, maybe a little over now, who was utilizing some of the drug checking strips that we've been providing. So that was really good to see them using it. I believe they were testing a batch of heroin, and this batch came up positive for xylazine, fentanyl, medetomidine, and benzodiazepine. So I am not sure if this was a single issue or how much of this same batch had gotten out to other areas of the county. But it was quite alarming to see all 4 of those substances initially give a positive result. So we've been in regular communication with the individual. And some of the feedback we're getting from them is that a lot of people don't want to, and this is obviously adults, so 18 and up, but a lot of people don't want to use the drug checking strips simply because they're either so far into addiction or reliance on substances. It just they don't want to know. It's kind of like an ignorance is bliss thing. So it's good that we have these materials, but we don't, try to push any one way on anyone. So I just wanted to share that observation, so that we know all those substances are in certain batches in the county right now. Thank you.
Thank you, Renata. I appreciate that update and good job getting out there in the community. Does anyone else have any questions?
I actually have a question for Joanna. I'm not sure if you would know yet because this is hot off the presses, but with Delta 8 now and all those off THC products being banned federally, is there any guidance you have on enforcement or what that's going to look like going forward if they're continuing to sell these products?
Great question. I don't have that information yet. I'm hoping that they'll bring it up, and by they I mean DEA headquarters, from a higher perspective down to us. But if they don't, I'll definitely address it. Because when you mentioned it, I was taking notes and I'm like, oh, we got to prepare for this in terms of like our outreach and stuff like that. So I'll definitely ask. We'll see. Hopefully they send something down. But we'll stay on top of that for sure.
Yeah, awesome. Thank you so much. Please keep us in the loop.
We'll do.
Yeah, I see we have a couple of people on here from the county and also from some of the schools. So, if anybody that's from the schools, if you're willing to share, what are you seeing on a local level in our schools? What's happening there? I know we still hear about vaping a lot. Is there anything else that's going on? Go ahead, Caitlin. Thank you.
All right, so this is all very interesting because we just started sharing the information. So for those of you that know about it, there's a survey called the Pride Drug and Alcohol Survey. They just recently rebranded. The name is escaping me, but it's the Drug and Alcohol Survey that we've given every other year since 2019. So I guess 3 times. But Berners Township has been surveying our 6th, 8th, 10th, and 12th grade students for the past over 30 years, maybe almost 40 years. I'm not 100% sure. We did the American Drug and Alcohol Survey, and then we switched to Pride. So according to the data, it seems like everything is kind of dropping off, but that always is dependent on the students who are responding to the survey, the students who are actually taking the survey once their parents give permission. So I take this data with kind of a grain of salt, knowing that it's just another tool. There's also anecdotal information. There's information from the school itself, who I work pretty closely with. I feel very lucky about that. But anyways, the data is saying that certain things most drugs are dropping off. But what we are seeing in the data is that there are a fair amount of students that are choosing to be sober. And like when I do the air quotes, they're not using and then saying they're sober. It's more like I'm just not starting those things. But it looks like the students who are using are starting younger. And they're starting with things like vaping. There's a really high percentage of, the 6th and 8th, maybe not necessarily the 6th graders, but the 8th graders by the time, they take the survey usually in like November, December, so they're not midway through school, but they're well into their 8th grade year. So either they've started in 7th or 8th grade, or they're seeing it even younger, they're seeing it around them. But it does look, but what's also changing is obviously risk perception of things like marijuana and things like honestly nicotine, where they're seeing it being used more, so they have less of a perception of risk, or a perception of harm. And what was the other thing I was going to say? All this survey information is on our website, which I'll throw the link in the chat if anybody wants to see the results. But we're already planning to do the survey in 2026 again. And like I said, Pride has recently updated, so we're hoping that the updates that they've made and the questions that they've changed in their survey are going to be more appealing to the students and the parents who are giving consent and ultimately taking the survey. But I just thought that was all very interesting, that certain things are dropping off, risk of harm is changing, and the students who are choosing to use drugs and alcohol are starting earlier.
Yeah, I was in a meeting earlier this week, and someone from the Hunterdon County Prosecutor's Office kind of said the same thing about seeing younger use. Are you also seeing any upticks, Caitlin, in girls using more?
Ooh, I didn't look at it sorted by sex, so maybe I don't think there was anything. And we also work with Community in Crisis. They look at the raw data. Unfortunately, I don't think they have the person who's analyzing the raw data on their staff anymore. But she also did, and this is all under the link I'm about to throw into the chat as soon as I find it. But they did like a summary, like a highlight summary, and I think they would have pulled that out if there was anything in particular. But I do know that the reason many girls stopped using things like cigarettes is that it was gross. It's making my breath smell or my teeth look yellow. And vapes don't, to our knowledge so far, don't do things like that, and they have fun flavors, which girls do tend to. I think we all know this, but girls tend to go towards like the fun flavors. I think guys do too, if I'm being honest. But I don't think anything popped out data-wise. Anecdotally, I have a reach meeting today, so I'll ask if they've
Okay,
noticed
great.
anything.
Thank you. Thanks for sharing the data from, I guess it was Pride, and now Sergeant Martinez says it is called DATA, DATA, Drugs, Attitudes, Trends, and Approval. So I guess that's the new name. So thanks for sharing that. And Elise has her hand raised.
I think you're muted, Elise.
So Caitlin's little report out triggered a few things in my mind, as far as we have a smaller caseload of females to males, much smaller. However, I think every female I've had on probation in the last 3 years, they all used THC. So it's an anecdotal thing, and it's not statistically significant, but that's what I have recognized with the kids that I've had on probation. Also, one thing that I think was really triggering for me was a lot of the kids report that they started using, maybe not necessarily the first time, but a lot of times they would say the first time they did it with their parents, which I thought was very disturbing.
Yeah, that kind of goes back to the low parent approval of their kids using substances, THC being benign, it's just a plant type of attitude. So thanks for sharing that. That's, like you said,
well,
frightening.
and to like even add more insult to injury, some of the parents get upset when we test the kids for it. Like, how dare you tell us how we should be parenting?
Yep, always a challenge for sure. Anyone else any of our presenters that are on today, are you seeing any changes of your caseloads, being that they're is an uptick of girls on your caseload?
Not so much as a gender specific thing, but just with vaping alone. I think the biggest thing that we're seeing is nobody knows how to get rid of them. They're advertised as disposable, but yet we can't just throw them out. So it's a hard balance in between all that. And this is a bit of a selfish plug for me, but just wanted to put it out there on you guys' radar at least that back in July and now like fully solidified, I started my own motorcycle association just to kind of build more of a community through resilience and fighting through adversity and things like that, and just trying to help community members throughout the state in any way that we can. And I think aiming more towards like the spring, coming up on the warmer months, I'm gonna figure out the logistics of it, but I would like to organize a vape disposal day, kind of like how DEA Take Back Day has. And if there's a way that we can figure out a location or something, set up a table, and if anybody wants to come and bring their vapes in, we'll take it apart right there in front of them, take the batteries, and we'll dispose of it on our own. But that's just something that I wanted to put out there. And if you guys are willing to help with that, by all means, I would love that. But it was an idea that came up, and I would really like to see that come to light. So hopefully by the spring, maybe more towards the end of the school year, maybe, I don't know. I'll figure out the logistics on how we can properly get rid of them. But if there's a place where no harm, no foul, you come and drop it off and walk away, then I'll take that over causing a fire somewhere else.
Yeah, that's fantastic. In fact, I'm going to put Amanda on the spot. I know she's not raising her hand, but she has a lot of experience with doing vape take backs in the school. And Caitlin also mentioned in the chat that she'd love to see that happen in Hunterdon as well as Somerset. So Amanda,
I didn't want to be greedy and
keep a
say
few
just do
words.
one in Bernards, but you know.
That's okay. Hey.
101st, come on. I've still got vapes in storage since we started doing take backs in like 2019.
Oh my God, yeah. Nah, so that's where it's I have to favor Hunterdon because I live there too, but
Yes!
I will happily go from Hunterdon to Bernards. I'll go anywhere you need me to. But
Yes!
yeah,
Thank you, thank you. Any help we can give, please help us.
absolutely. I'll definitely reach out and we can link up more about the logistics.
That's amazing because those things are disgusting. I have to put on gloves and then I accidentally touched my face and it felt like it was on fire. It was
Now things are numb and yeah.
oh, it's so bad.
Yeah, it's great. Amanda's been doing that for quite a while, working with different schools where they do a vape take back. So she could tell you all the logistics because, like you mentioned, Sergeant Martinez, you don't want to like get the kids in trouble. It's more about getting rid of
Exactly, yeah.
items. So yeah.
I see Donna has her hand up.
Yes, this timing of this conversation is perfect. At our last Franklin Township Board of Health Advisory Council, which I chair, I brought this up about possibly adopting an ordinance for safe disposal. And we tossed around the idea because there was an excellent article that was just published that looked at all the hazards, not only, the health hazards associated with vaping, but also the environmental hazards with all the heavy metals and chemicals, as well as the lithium batteries. So there was interest at our township about doing this. So I will partner with whoever wants to work on this in Franklin, and please reach out. I'll put my email in the chat, and I'd love to connect. Our next meeting is going to be December 3rd. So if there's anyone who has any information, I would love to share that and try to get this off the ground in Franklin. We have a huge problem with vaping in the high school. And so this would be wonderful, getting these out of the environment, and also educating while we're doing that about the harms associated with this. So, thank you. Thanks, Jerry. I see your response in the chat.
Yeah, thanks, Donna. Appreciate it. You guys are always rocking in Franklin as well. Always up on topics and willing to do things about it. So thanks again for that. We appreciate all that you do. We do have about 5 minutes left. Is there anyone else who has any information, anything they'd like to share? Any major events that are coming up?
I have a question for Amanda. It's Staff Sergeant Maldonado on the collection of the vapes that you said that you have in storage. Is that you? Yeah. So you take that from the schools, and you said you guys have your own little storage area for them, like that you guys collect in bags, or do you have them? How do you guys collect them specifically?
Yeah, so we've done vape take back days at schools where kids can anonymously turn in their vapes, and then we give them quit resources and all that good stuff. And by storage, I mean a tubby in my garage.
Okay, I was curious on that because like Sar Martinez said, that's been the talk and questioning on how we're going to dispose of this. And yes, DEA Take Back, does disclose that they do take it, but it's up to the towns that collect them to take them apart. And, nobody knows how to do that safely or, wants to do that because of all the chemicals. So, yeah, I always ask how, everybody else is doing it.
The only way I was able to get rid of a little bit of this vape stuff was in the beginning. You remember people would buy the vape juice and then put it in their fillables. I was able to take that to the county hazardous waste day, but other than that, I would have to take every vape apart and take the battery out to get rid of that, and then the nicotine juice or whatever separately. So yeah.
All right. Well, I hope that the law does get passed on hopefully soon or rather than later, that gives the responsibility back to the manufacturers to deal with that and figure it out for themselves instead of just bringing this out into our communities and having us figure out how to properly and safely dispose of this.
Yeah. Hey Ken,
thank you.
Hand up.
Yes, thank you. Thanks everyone. I see that Caitlin put in the chat that they're having a 4-part documentary series coming up. Caitlin, if you send us the information, we'll be happy to get that out to everyone. Donna just put some stuff into. So anything that we see in the chat, we will make sure that it gets out to everyone. As well as our next meeting that Nick mentioned earlier today is going to be a celebration in December. Whoa, we like to have a celebration. The celebration that the coalition does every year is really not just about the coalition, it's really about everybody on this call and all the agencies and people that work so hard all year to keep our youth safe and keep our communities safe. So it's kind of just a thank you. So we will have a breakfast. It will be at RVCC. I believe that Amanda put it in the chat, but she'll definitely send it out. But we need people to RSVP so we know how much breakfast we should order, as well as what goodies to bring. The coalition always has a little thank you and some other goodies, and you typically have some fun activities. So we'll keep you posted, and if you know that you can make it, if you can register, we'd really appreciate it. It's very helpful for us.
Yes, and I just want to give Ken 30 seconds because I know he had his hand up for a few minutes, so I just want to give him a chance.
You could take 32.
I was going to say I might get it in 17. So I just want to let everyone know that we officially have our exterior sign on the Franklin Township Hub, so we're pretty excited about that. Makes it that much more official that we've got roots in Franklin Township. So we're located at 873 Hamilton Street in Franklin. We're there part-time 20 hours, but normally we're there more hours than that. So please feel free to drop by and see us and refer folks to us so that we can make those connections in the community.
Thanks,
Thank
Ken.
you, Ken, and congratulations, and thanks for filling a need in the community. So that's awesome work from CIC. Thank you.
And thank you to all our special guests that joined us today to share all your information. And please feel free to come back every month. We would love to have you give us updates on anything that you're seeing. All the information is much appreciated by everyone. And we will see you next month for the celebration. So please RSVP to that, as Jerry said.
Thank you. Have a great day, everyone.
Thank you, everyone.